Climate change impacts our health in many different ways. The obvious one is that with increasing global average temperatures, and we're also getting a lot of extreme heat, but climate change is also changing our rainfall patterns. We're getting increasing droughts, but also floods, and they also impact on our health through affecting our food security, through potential for contamination of water and diseases that arise out of floods and droughts. It also makes storms stronger, so more climate-related extreme events that can also, of course, harm people directly, but then have flow-on long-term impacts through destruction of infrastructure, loss of homes and livelihoods, and some infectious diseases that will arise as a result. UQ students, along with any young people, will be tackling climate change whether they want to or not, because climate change is having such a big impact on our society. So therefore it's really important that we equip students to be able to do that and to play a really positive role in shaping our future in these challenging times. And I think UQ really aims to assist students with doing that by equipping students to tackle things that we don't know yet, while we can predict the increases in temperature and some of the changes, weather pattern changes. We can't really predict how a society will respond. In the School of Public Health, for example, we're reviewing all of our programs and courses to increase the climate change content. We are doing our best to make sure that students in the public health arena are well equipped. We also have now introduced more climate change content into the medical program. Doctors can play a critical role in terms of advocacy for action on climate change. Well, all of us in wealthy countries are responsible for way too many carbon emissions. It almost goes without saying with a rich country lifestyle. So we can reduce our own emissions by reducing our car use. That's a really important one. By reducing our use of air conditioning and heating and so on. And by consuming less. Consuming a large part of our emissions is from our consumption. Also, eating a healthy diet will also mean that we're responsible for fewer emissions. But most importantly, we also need to be involved in the advocacy. I think the individual actions are really important, but collectively the actions that need to be supported by appropriate policies within governments are going to make the biggest impact, and we need to be part of the advocacy in order to achieve that.